I'm just going to talk about using our biosensors, how we can monitor multiple patients at a time. Now, biosensors can be worn by patients either in hospitals or at homes. If it is in hospitals, what we do is through network, multiple patients' data is transferred to a server, which remotely can be monitored by multiple patients. Similarly, if a patient is at home, they can use a mobile phone. Through their mobile phones, the data can be transferred to a hospital network, and similarly, the hospital network, through that also monitoring can be done. Let me give you a little bit overview or a brief overview about how this whole platform works, so that how using our platform, how the productivity of nurse can be completely increased, because right now using patient monitors only at a time maximum of 15 to 30 patients can be monitored, but whereas using our biosensors and using these platforms at a time up to 200 to 300 patients can be monitored by a single nurse, thereby increasing the productivity of the patients. Also, using our biosensors and platforms, unlike many other devices, what's so-called wearable devices, ours is used for active monitoring. When you say active monitoring, using our biosensors and the platforms, clinical actions can be taken by the monitoring data coming from us, because ours is what we call as an alert-based system. This alert engine is approved by FDA and also CE. So let me explain how this workflow works on it. So the first thing is the biosensors is easy to wear by a patient, either by clinicians or by patients at homes. Now all this data goes to a server. In a server, if I'm a clinician or a nurse, I have an access to a server using a unique passwords. I will log in. The moment I log in, I can see the status of I will have access to what is the patient's details. In this, you can see I have, for my access, I have around almost 132 patients which has been currently monitored. And then we can see there are some 6 patients who have a clinical alerts, and then 10 persons have a technical alerts and 6 patients. So this gives us the overview of what's happening on the patients which have been monitored. How we achieve this is like this. Assuming that I'm a patient, I'll be linked to a specific locations. When the location in the sense, for example, where exactly I'm admitted, patient is admitted in a hospital in this specific wards, I link that using this portal. Digitally, I link the patient's location. Similarly, a patient is coming for a specific disease, then the disease is also linked to that. And similarly, if you are a nurse, the nurse has been assigned to monitor a patient's set of group of patients, either a specific based on a clinical conditions or a locations. If the patient is, the nurse has been asked to monitor a ward, then they will be assigned that ward set of patients. Instead, a nurse is a specialist. For example, a nurse who is specialized in looking for a sepsis patients, they can link all the sepsis patients there. So the moment they log into the dashboards, whomever is their access, they can see that. Now, another point is, unlike a traditional monitoring where somebody has to keep on looking into it, ours is a completely alert-based systems. They can set the alerts for a group of patients. For example, they can set the clinical alerts. When you say clinical alerts, they can set the heart rate, respiration rate, and every parameters they can set the alerts. This is a very intuitive and also very powerful tool to set the alerts. Now they can set the alerts for the whole hospital, or they can set the alerts for a group of patients. For example, depending on a medical condition, they can set the alerts or the locations, or individual alerts also be set. Now, in the alert settings, they can set the threshold, what is the minimum and maximum under which. Similarly, they can set the priority. Depending on the priority, the number of types of alerts will be different, and similarly, alert delay time also set. So this can be set. Similarly, you can set the technical alerts. For example, if the patient is biosensor is, they have gone out of the range, wireless range, you wanted the alert. Similarly, you can set the technical alerts. So all these alerts are once configured, then it is easier for nurse to monitor the patients without continuously viewing it. What they will do is, they will get the notifications. For example, you can set the alerts, all these clinical alerts go to a SMS for a specific care provider, for example, a nurse or a doctor. They can be anywhere. For example, a nurse need not be in the hospital continuously monitored. They can go to for example, a cafeteria to have a coffee, but still they can be monitoring a patient. Similarly, a doctor need not be in that location. They can be around 5,000 miles or even across the globe, and then they can monitor the patients because he will have immediate information of the patients. Okay, this patient's heart rate is gone higher. They will get a message in their app or in the SMS or a WhatsApps. Moment they get it, they can log into the platform, which is a cloud-based platform, and then see what's condition of the patients. So, for example, I get an alert. I know what do you want to see here. These patients have alerts. I can go there and click, okay, what's happening here. I can see that this patient's heart rate is more than 120. And then I can go and see what's happening here. I can go and see the patient's heart rate, and then I can go and details of the whole complete patients. As you can see, we monitor continuous ECG also. One important point is almost 30% of these people here die because of cardiovascular diseases, and ECG is being ignored as a monitoring parameters because ECG required to be a continuous monitoring, and most of the devices which are wearable devices doesn't do a continuous monitoring, whereas we do as a continuous monitoring. While the nurses or doctors need not be looking at continuously, we continuously monitor, and then through alert based system they can always intervene what's happening. So it's a monitoring is 100% continuous in a background, but the nurse or a clinicians need not be continuously be looking at the dashboards. So that way we achieve the continuous monitoring. You can also see that we also have something called early warning score, which is the early warning score which is approved by NHS in UK. We are introducing that in India. This is very powerful tool to find out how much deterioration is happening on a patient. Using this, they can identify whether the patient is deterioration is required of subsequent. So the alerts also is based on the EWS score also. So using the alerts engine, the active monitoring, and all these kind of AI tools which is alert based, we can make sure that multiple patients can be monitored at a time and increasing the productivity of the nurse. Our platform also can be integrated with other devices, for example, a third-party devices like a BP device, so that it is mimicking the patient's monitors at bedside monitors, patient monitors also. Another aspect which we want to talk about is the alert acknowledgements. Many times the nurses gets lot of alerts and alarms, which is what we call it as the alarm fatigue. So if too much of alarm is also as bad for a nurse, because then she loses the focus in doing that. So what we try to achieve, that is what using this alert acknowledgements and the priority, we try to avoid it. Once the nurse acknowledge the alerts or the doctor acknowledge the alerts, then we don't necessarily need to send the alerts again and again. So using the alert acknowledgements, and also the way of doing the priority, we avoid the alert fatigue for the nurses also. There's one more important features in our using our biosensors and platform is our biosensors also can be used a nurse call alarm. The button on the biosensors moment it is pressed, then that indications will be automatically transferred to a clinician or a nurse. So they know that something is happening to the patients. So that way also the biosensor also can be used as a nurse call alarm. So it is an integrated device. It is not only a patient monitoring device which monitors vital sign. Our biosensors also can be used as an event or a nurse call event. So for example, a patient is feeling dizzy. She doesn't need to call anybody around it. Moment she presses it, automatically there will be indications which will go. The destination who gets the alert is also programmed in that. Using that, they know that patient having some discomfort. They can immediately attend the patients. And then in addition, they can go and understand, okay, they have taken some medications, what is the medications they have taken it, what is it what is it happening, it can be noted down so that the next person, next nurse also understand this event has happened, this is what is attended by physicians. So the platform allows them to do this event monitoring and the notes also. Then the platform also allows us to look for the complete trending. So because very important is most of the time it is not just the current data which matters, the trend of the patients is also matters. So using our platform, they can understand the history of the patient's vital sign monitoring. So using our trend, most powerful trend, we can always monitor, they can always identify what's happened for last 15 minutes or even for last 5 days when they've been monitored, what is the status of heart rate, what is it. So because that is more important for a clinician or a doctor is not the actual data, it's how the trend is going in. Combined with our continuous monitoring of multiparameters and the ECG, the trend, the graphical trend is very powerful tool for any clinicians to understand and then do a necessary diagnosis of a patient.